Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us once again today. We have in studio with us a returning guest, Mr. Chris Maddocks. Chris Maddocks is Senior Vice President of Marketing and Communications at the March of Dimes Foundation, and he's returning with us to talk about a collaboration between the March of Dimes Foundation and Ferring Pharmaceuticals. They aim to expand research needed to end premature birth and basically establish a sixth Prematurity Research Center in Europe. Welcome back to Health Professional Radio, Mr. Maddocks.
Thank you for having me.
Give us a bit of background about yourself and talk about your role as Senior VP of Marketing and Communications for the March of Dimes.
So I'm as the Senior Vice President of Marketing and Communications, I oversee both all of the, everything that you would expect from a nonprofit entity, fundraising and marketing and those pieces. But I also work extensively to make sure that our health communications are reaching, educating and engaging audiences that have health information needs and are looking to either improve or understand their health in different ways.
Is the March of Dimes involved deeply with policymakers when it comes to healthcare in the United States?
Yeah, the March of Dimes has been a significant voice for the health of mothers and babies in the United States, and that's both historically and currently. In the past, the March of Dimes, I think most people are aware that in every state there are universal screenings for birth defects. That is a piece of policy that came to be through a March of Dimes kind of continued advocacy to make sure that that babies were screened so that they could seek as quickly as possible the interventions that they need to start their lives, strong and healthy. Most recently, the two advocacy initiatives that we've been most focused on have been last year, as the Zika crisis deepened in the Southeast United States. March of Dimes worked very actively, leading a consortium of over 120 organizations to ensure that the CDC and other parts of our and state governments were funded to be able to, prevent, track, and ultimately to research and advance cures to the Zika epidemic, which, as many I'm sure are aware, most directly impacts mothers and pregnant women and their babies.
What efforts is the March of Dimes involved in? Major efforts in order to raise funds for this research.
Yeah, so one of our most significant events is the March for Babies event, and it's a walking event that happens in over 500 communities throughout the United States. And what's exciting about that is that both families that have been impacted by some of our issues like premature birth or birth defects, as well as families that just believe that every mother and baby should have a chance to be strong and healthy. All of those individuals come together and ask their friends and family to support and then fundraise on our behalf. So it's a really wonderful show of solidarity, both for those that have been directly touched by our mission, but as well as those who just believe every mom and every baby should have the same chance at a healthy start to life.
Talk about your collaboration with a pharmaceutical company. Is that just one pharmaceutical company, or are you involved with pharmaceutical companies and other developers of healthcare products in an effort to prevent birth defects and other abnormalities in childbirth?
Yeah, so we work with industries, and sectors across with companies across the healthcare sector. One of our most significant and exciting pieces that's recently come to bear is we have finalized a partnership with Ferring Pharmaceuticals, who is a Swiss-based pharmaceutical company, and we've been very fortunate that we've been able to announce that Ferring has made a $10 million grant to the March of Dimes to help us advance some of our innovative and groundbreaking research to prevent premature birth at the global level.
Are some of the policies there at Ferring in conflict with some of the policies that are established as far as the United States is concerned? And can the March of Dimes navigate those similarities and or differences when necessary?
Yeah, what's interesting about Ferring as a Swiss-based company, perhaps less so on the policy side, but more so that Northern Europe and Western Europe in general have some of the lowest preterm rates across the globe. In the United States, we have preterm rates that are, between 9 and 10%. I think 9.6 is the most recent published statistics, whereas in countries like Lithuania, Finland, Estonia, Ireland, these are countries that routinely have preterm birth rates closer to 5.5%, which really opens up for, preterm birth is such a global health issue. As March of Dimes looks to advance, innovative research that can impact, premature birth, not just in the United States, but on, across the world. It's a very logical place to have a foothold and have our research community extend into Europe to kind of study and open up some of these different lines of inquiry via Ferring and a European-based Prematurity Research Center.
Do you, at the March of Dimes, find that there's a different mindset when it comes to some of these birth issues in Europe as opposed to the United States? Yeah,
I think that as we think about premature birth as a health outcome affecting a mother and a baby, I think that there are significant differences in policy and philosophy as it relates to the delivery of healthcare and how mothers are supported through their prenatal period and then supported after they give birth. So I think that there are, whether that's access to healthcare or access to insurance and universal coverage, European nations certainly do have a very different approach to that. And it's one that is interesting to explore as within the United States as we have our own national conversation around what it means to be a strong and healthy nation.
In talking about such a high rate, premature birth rate here in the United States, as opposed to those rates in places that you mentioned around Europe, what are some of the causes of premature birth? And we're not talking birth defects or even mortality, but just, being born too soon. And with this collaboration with a pharmaceutical company, are you looking to maybe perhaps develop drugs that prevent premature birth?
Yeah. Right now, the primary focus that the Prematurity Research Center, so the one that the Ferring grant is helping open, will become the 6th Prematurity Research Center, this one based in Europe. And in terms of moving towards specific pharmaceuticals or drugs or prevention mechanisms, that's really not the focus of the Prematurity Research Centers at this time. At this point, what we're truly trying to understand is developing understanding the biological model of delivery overall for being such, which is an interesting thing to think about, is for being such a fundamental biological reality for every person on this planet. It's very, the knowledge base and understanding of labor and delivery are not particularly well understood. So one of our hopes is that within these prematurity research centers, we will develop a more clear knowledge and evidence base around the biological model of labor and delivery, and that will then allow us to better understand the root causes of premature birth, which will then, of course, at some point in the future lead to either clinical interventions or potential pharmaceutical or other types of outcomes of, again, the first goal is really understanding, why do women go into labor in the first place, and what causes that to happen prior to 39 weeks of gestation. Those are fundamental questions that the March of Dimes is seeking to unlock and to be able to offer that understanding and knowledge to the world.
You mentioned a figure in the research contribution made by Ferring. It was $10 million. And you did mention some statistics earlier in our conversation concerning the rate of premature birth in Europe and in the United States. But let's put it into perspective, something we can bite onto. What types of numbers are we looking at as far as premature birth worldwide and here in the United States? Just so we can, in an effort to get the word out and put it into perspective for our listeners, how big are these numbers actually?
Yeah, I think at the March of Dimes, I think we would go so far as to say that even one one baby lost to preterm birth is too many. But in reality, the number is multifold above that. So currently at a global level, the most recent World Health Organization statistics place the number of children that die from preterm birth complications at over 1 million globally.
Wow.
So that is the leading cause of death for children under the age of 5 of all causes, and to put that into just perspective, that's more than car accidents, drowning, and other issues combined. So it's a very significant issue, and one that we don't believe gets the attention or, frankly, the funding to address something that is so significant. Here in the United States, where there are over 4 million children, 4 million live births annually, over 400,000 children will be born every year that are born too soon. So that's before 39 weeks of gestation. So even within this country, that's over almost 9.6% of all births experience that level of prematurity. It's a significant issue, and one that we think is makes good sense for reducing infant mortality overall, but is also for our society one that has a significant cost, both economic, psychological, and human, and it is absolutely the work that needs to be done, and the right work to do.
Now, where can our listeners go and get more information about the March of Dimes, the collaboration with Ferring Pharmaceuticals, and possibly get involved in some of your efforts to prevent these defects, premature births, and infant mortality?
So individuals should go to www.marchofdimes.org, where they can find information on how to get involved and to read more about some of our innovative research.
Well, thanks for returning with us, Mr. Maddocks. It's been a pleasure as always.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Chris Maddocks, Senior VP of Marketing and Communications at the March of Dimes Foundation. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.